Hey, you Mavericks, thanks for joining us today. I'm very, very happy to be here with Laura Wilkerson, who is a nurse practitioner who was going to be joining us this week at our live Mavericks Summit, which we have rescheduled. Welcome, Laura.
Yes, good morning, and thank you for having me this morning. I appreciate it.
Yeah, we're very excited to be speaking with you about all of this around COVID-19. But first, let me give our audience a little information. My chief curiosity maverick, Francis Legassi, is actually in a car and unable to join us today because he had been traveling with his family and they are practicing social distancing by driving home from Florida. So he's probably listening to this in the car, hopefully not driving at the same time. And we are practicing social distancing by doing all of this over live stream. We're not in the same location, and our producer is in his studio in a different location. And I really just want to point that out because I think one of the things we're really going to be talking about is how do we protect our aging parents during this time. So Laura, can you tell our audience a little bit about who you are? You own several businesses and have owned others in the past around our aging population. Give our audience a picture of who you are.
Yes, so good morning, everyone. My name is Laura Wilkerson, and I am a nurse practitioner. I have a practice here in Michigan where we do house calls to those who are aged and can no longer get out of their home. So we actually provide medical care, doctor to your door, nurse practitioner to your door, here in Michigan, to private homes, assisted living, senior housing. So that is my main thing that I do. I have a bunch of wonderful providers who work for me and a great back office staff. A shout out to them because they have been handling a lot of calls this week, obviously. Yeah. And then I also have a business called Dementia Care Academy, where I go into senior living facilities. I help them educate their staff about dementia and how to provide the best care for those who have dementia and get them, up to date with the new guidelines on how to care for people and trying to take away that one size fits all approach. And then I have some business partners that I work with, and we help consult with people who are wanting to get senior living facilities up, and they just don't really know what to do. And I've previously owned an assisted living facility in my past, so I can feel the pain of what everybody is going through right now and what they must be thinking and what they're doing at this time.
Yeah, so you've really played almost every role in the aging population, and I applaud you for that. I think I know you, and I know that you have such a generous heart for this population. So let's dive into that. And I want to ask our audience, if you have questions, please post them in the comments. Let us know throughout this episode because we can answer them live here. And even afterwards, we'll answer questions that you may post. So definitely let us know. But I think one of the most pressing questions for most of us who are family members is how can we protect our vulnerable aging population right now?
Absolutely. That's a great question. So if you're living with your loved one and they, in your own home, definitely, the CDC recommends right off, the first thing is good hand washing. You cannot wash your hands enough. Protect your loved ones. If you are homebound with your loved one, obviously, and not going out into the community, you're relatively safe if you don't have too many visitors coming into your home. But if you're still working, if you're in that sandwich generation and you're still working, obviously practicing those social distance guidelines, and that means 6 feet away from people. And that's a little bit hard, obviously, when you're working in tighter conditions like cubicle conditions, but keeping your distance away from people, keeping hand sanitizer if you can find it.
Good luck.
Keeping a bottle of that at your desk or making your own. You can buy aloe vera lotion and you can use rubbing alcohol, mix the two of those together and make your own if you can find those two products. Keeping a box of Kleenex on your desk And when you cough or sneeze, coughing and sneezing into those and putting that right into your trash. Don't put it in your pocket. Don't put it up your, up your sleeve. If you see your mom carrying Kleenex up her sleeve, get up, throw them away. I mean, how many times have you done that? Looked up their sleeves and there's like 82 Kleenex, shoved into their sleeve. But just making sure that, you're practicing really good hand washing and really good guidelines that way is probably the best way we can protect our aged. If you have teenagers that are still in school, if they're running a fever or have a cough or, obviously we're all very concerned about COVID, but there's other things that your children and yourself can carry. Influenza, strep throat, common cold. So protecting our loved ones that way. From any sort of conditions. We should have been practicing these guidelines all along.
I think that's maybe a really important thing is this should have been the norm.
Yeah.
And maybe it will become more of the norm now. And I have a question I want to go back to. You mentioned aloe vera and rubbing alcohol. I was actually Googling because we cannot find even soap is completely out. Fortunately, we have enough of a supply at home. But one thing I will say is we always look for the liquid soap. There's plenty of bar soap. Use the bar soap if you can't find the liquid soap. I noticed that people are buying all the liquid soap. But I was Googling for homemade options if you can't find the antibacterial gels for your hands. Mm-hmm. And I couldn't find anything that said rubbing alcohol would kill the germs. Is there anything you can speak to that?
Well, for sure. But they've said that anything that's like 97% alcohol, if you're going to be cleaning a surface. So if you think about rubbing alcohol, obviously that's a little bit more than 97%. So I think you're pretty safe in using something like that. You wouldn't want to use it on your hands. It's fairly caustic and drying. Or on aged skin, you're not going to want to use that because it's very drying. It's the same thing that's, outside in the pumps if you're going into the hospital. It's that same kind of foamy soap. So you're not going to want to use, and same like you were saying, foamy soap is not an option. So those nice little like Bath and Body Works foam soaps that you get that you put in your house, in your bathrooms, use the liquid soap, the liquid hand soaps. Those are really the best, making sure that you're getting your hands good and scrubbed at least 20 seconds to wash your hands. I know I posted an article earlier this week or some little tips earlier this week. The COVID virus is surrounded by a lipid layer, a fat layer. So meaning if you've got soap on your hands and you're aggressively rubbing your hands together and then putting them under the water, the COVID-19 is going to break open, that molecule is going to break open and then therefore be destroyed and washed down. Then using paper towel. In my house, I do have a couple of regular hand towels around, but I'm going to be removing those and putting paper towel up in my bathrooms.
Okay. All right. Excellent. Those are really good points. So let's say as a family member, you have a loved one in assisted living right now or memory care or skilled nursing. And obviously they're all on lockdown right now, which is absolutely appropriate. How do we feel connected to them during this time? What do we do?
Yeah, that's becoming difficult, right? So if your facility has chosen to lock down, and I know like here in Michigan, our governor has mandated that even some of the hospitals are closing their doors to family members. I do believe from what I've read, you do have 30 minutes of entitled time. Now, that's not true with every assisted living, but if your family member is in an assisted living, if they're capable, if they're able, if they have a cell phone, certainly FaceTiming them or having one of the staff there help them FaceTime you is one way to definitely communicate with them. And phone calls obviously are another good way. Not only from ourselves am I a little bit fearful or thoughtful. I guess I shouldn't say fearful because I'm not fearful. I'm thoughtful. Thoughtful of these seniors is social isolation. As we become more and more protective of our environments that we're living in or that we have the aged living in, we're going to start to see a little bit more degrees of separation right now, people communally eat and dine in the same dining room, where we might start seeing them go into their rooms and dinners and lunches being served in their rooms in order to protect them, from outside agencies that might have to come in, from each other, because we just don't know at this point yet. So one of the things that I know I'm going to be doing here at Advanced Medical House Calls is kind of putting it out there for the community to sort of step up and help our loved ones while they're in social isolation. Or while they're in isolation, if they've got the opportunity to send coloring books, or if you've got any extra crocheting material around that you can donate or drop off to help keep people active while we're going through this, I think that those are really nice things that we can do to step out of our own selves and help people that are being,
I love that. And when you told me about that earlier, I said I really want to hop on that bandwagon and help here in Denver as well. So I'm going to ask our audience, anyone who's from the assisted living or senior living communities, post, what do you need? What would be helpful for people to donate? And then for family members, I would love to have you all post and tell us what your parents or spouse's assisted living is doing. How are they keeping you connected? So given that, and I mean, all of this is really hard. I think that's an important thing. I also do want to say I spoke with an assisted living here in Denver just yesterday who said they had a family member visit who had been diagnosed with COVID-19, and it was like 14 days ago, so they're probably safe, but that family member didn't tell them right away. So I beg you, family members, please don't go visit if you have symptoms, if you think you've been exposed in any way, shape, or form. It's not safe for your parent. It's not safe for the other people who are there.
Yeah, absolutely. I mean, even taking your temperatures, I've seen a lot of facilities that are taking temperatures in door entrances. If you think about it, your child, let's just use your child, for example. I'll use mine. My son was sick a couple of months ago when he went out skiing, and, he came home and he looked great by the time that he got home. And it was actually about a week later, I think, that I ended up being down, and heavy down. 2 days, I don't really remember too much of that. So if you think about that, if you're feeling puny in any way, I don't care if it's just like a little scratch in the back of your throat, right now, stay home. There's nothing that pressing that you need to be doing. You've put your loved one in an assisted living for a reason, to allow others to care for them. So let them do their part, and let them be an extension of your immediate family, and take care of your person right now during these circumstances. Because the opposite side of the spectrum, getting your loved one sick, you probably would have a hard time on your heart.
That's a very good point.
Thinking about what if.
Yeah, that's a very good point. And also to say the other people that would be impacted by that. Yeah, and I like that you said trust the people that you've hired. Now is the time to really be honestly thinking about the assisted living staff as your care partners. They're there to do a job. They're trained. They know what they're doing. They have protocols in place. And I think that is one of the most important things that we can do, is trust them. So our last question here, what do we do if there's someone with a confirmed case in our community?
Sure. And the guidelines on that are changing. It almost seems like hour by hour right now. So if you have somebody that calls you and said that they had tested, and that they had tested positive, and they are exposed, if you are a primary contact, meaning you had direct contact with that person, you should probably yourself go be tested. Say you were in contact with a person and self-isolate, which I know that's kind of contradictory. I've just told you to go get tested, but then self-isolate. So you should probably go get tested and then self-isolate. If you're a secondary or tertiary person to that person, right now they're saying that you're okay, but should probably put yourself in isolation for a few days. If you are a person that got tested, you should not be going and visiting your loved one. I'm going to say it. That's a little bit, I think, selfish on our part to do that because they are community dwellers. And that's not just going to spread to your loved one as you might cough as you walk by the food service area or touch a door handle after you've coughed and not thought about it. So stay home.
Yeah.
As the guidelines change, if a whole facility gets it here in Michigan, we don't have that. But if it comes to the point where we've got whole facilities that have contracted COVID-19, I'm sure that the guidelines will change. I don't know what will be the recommendations for the staffing at that point, but I'm assuming it would be very much like a lockdown unit at that point.
Yeah, and I was talking with a friend of mine in Spain this morning who said that their elderly living communities are on government lockdown for 1 to 5 months. So we hope that we don't get to that point. And what we want to do with the Mavericks is talk about the things that you can do and also create hope. So when I think about how we create hope here, I think the best way we create hope is to honor the social distancing, wash your hands like crazy, keep doing all of the things the CDC is requesting that we do. It really does make a difference. And I will also say that for senior living communities, I am offering, I have a software that is a HIPAA compliant messaging app for senior living communities to communicate with family. And I'm offering that for free during this time because it's the right thing to do. So get in touch with me. The links will be in the comments. My goal is to help families feel connected to the care that their loved one is receiving. I know that I have one customer who just had a new patient come from the hospital to their assisted living, and the family is like, I can't see them. I couldn't see them in the hospital. I can't see them now. This transition is hard, and we want to help make that a little bit easier for family members.
Yeah, I think you brought up another really good point, and I did want to touch on this. Most assisted livings have transfer packet forms. In general, if a patient goes to the hospital, they go to the chart and they grab out this paperwork. This is an opportunity. This is a time where that paperwork should be gone through, making sure that med lists are very up to date. So if your resident is transferred out to the hospital, that their med lists are very current. Giving any information about me, I haven't ran this course again for a minute, but I do have a course that I run with Dementia Care Academy, and it's the Make a Plan About Me. And it basically tells the story of your loved one, and it's documents so that you can give your loved one's story. The more that the hospitals know about our person and our residents, the better off that they are. So creating forms and checklists, can my person swallow? Can this person eat a regular diet? Providing all of that information to the hospital is vital and crucial. So making sure you've got those documents ahead of time is really important.
That's really, really great. And if they don't have those documents, Laura, do you have a suggestion for where they could find some?
For sure. I'm working on these as we speak, making some adjustments and making some changes. So as I get these forms updated, I will, post those on my website. So I will make sure to follow up later and drop my website, my web address inside of there. And in the meantime, I'll offer suggestions about what you should be including on those forms.
That's fantastic. And I will say to all you Mavericks, a couple things to be thinking about. How can you support our assisted living communities during this time with donations and things like that? And also, necessity is the mother of invention. You guys are mavericks. So let's start thinking really creatively about how we can create hope during this time. And we will all get through this. We will get through this. Laura, any last words you want to say to our audience?
Nope, just keep washing your hands. If you're a healthcare provider that's going in and out, if you're a hospice worker, a skilled nurse, a social worker, physical therapist, just have your emergency, PPE, personal protective equipment with you. You are a risk. Make sure you're washing your equipment, your stethoscopes, your blood pressure cuffs, and just make sure that you are doing your best to protect everybody that you come in contact with yourself.
Thank you. Thank you so much for your time today. Your website is posted here on the screen, as well as it will be in the notes. So if anyone has questions for Laura, check out her website. And as always, please check our comments, make comments, ask questions, whether it's after the fact of this live episode or not. We will do our very best to get answers for you. Thank you all for joining us today. Thank you, Laura.
Thank you so much for having me.
Take care.